Without Medicaid funding, Minnesota would be a poorer, sicker state. Right now, 1.2 million people residing in Minnesota rely on Medicaid. They are our friends, our family members, and our coworkers. Almost half of the people Medicaid serves are children, almost 600,000. Another 123,000 are people with disabilities. I mention this because I know more than 1 million people are depending on us to address the issue of fraud in our Medicaid system and to protect the services they rely on. The state of Minnesota and Centers for Medicare and Medicaid Services have always been partners in providing Medicaid services to keep the elderly in their homes longer, to help children with autism, and ensure people with disabilities, mental health diagnoses, and substance use disorders can receive the care and support they need. DHS has a long history of investigating fraud and taking action. And this last year, we have significantly accelerated our efforts to both fight fraud and enhance program integrity on the front end to prevent fraud. Working with CMS in the past several weeks, we have developed a corrective action plan to address fraud and program integrity. We agreed with their recommended actions and have begun work to implement them. In fact, many of the actions are in line with the work we have been doing this past year, and some expand upon them. Unfortunately, CMS's recent decision to withhold Medicaid funds is putting the people whom both agencies are sworn to serve at risk. Minnesota cannot absorb the loss of more than $2 billion in annual funding for these programs without catastrophic consequences for the people we serve. This is unprecedented. We can't find another example of CMS taking this kind of action in any other state. It's not corrective action, it's a punitive action. We are appealing the action because it appears that CMS is not basing its decision on a factual look at the scope of the fraud that they are concerned about, and all of us, especially us in Minnesota, have been accelerating our work to catch and prevent. This decision also fails to account for our history of close cooperation with CMS and our overall track record of addressing fraud. Since October, we have been focused on stopping fraud, strengthening program integrity, and hardening our programs to prevent bad actors from accessing them faster than we ever have before. Under the governor's executive order on fighting fraud, we have continued to accelerate and be more aggressive than ever before. We're tightening up our processes. We've instituted a top to bottom audit of our autism service providers, including on-site visits. We're working closely with CMS. We worked closely with CMS on discontinuing the Housing Stabilization Services benefit. We've disenrolled more than 800 inactive providers from our high-risk programs and thousands of inactive providers from the Medicaid program. We're increasing our vigilance. Prepayment review is now underway so that before payment is made to providers of fee-for-service claims in the high-risk services, we are taking a look at those claims before we pay them. We are implementing a 6-month enrollment moratorium for 13 programs with the highest risk of fraud. Pausing those new enrollments allows us to harden our systems, and we will be reviewing and revalidating providers in these high-risk programs. All of this work is being done in close coordination with the Centers for Medicare and Medicaid Services. CMS has already committed to conduct focused program integrity reviews of these high-risk services, and we look forward to participating in that process, receiving feedback and technical assistance and other assistance to eliminate fraud and strengthen program integrity. I hope that we can continue to work together to protect taxpayer funds and remain focused on our primary mission of serving people in need. Thanks, Jen. Jen, I think you're on mute.
Yes, I am. Always, always on mute. Thank you for letting me know. And thank you, Commissioner, for that information. John Connolly, I'm going to call you forward. John is the Deputy Commissioner here at the Minnesota Department of Human Services and has some more details to share with you about the actions that we're taking and the work that we're doing with CMS.
Thank you, Jen, and good afternoon, everybody. Thanks for joining us. Because Medicaid services are essential for so many people, it's important for us to remain focused on facts. We must avoid emotions, politics, and hyperbole that can cloud the transparency the people of Minnesota deserve right now. When CMS sent us a letter December 5th asking for a corrective action plan, we understood the sense of urgency they were communicating to us. With a December 31st deadline just 26 days away, we worked hard to provide the information they requested. We've been working on this issue as a top priority, as the commissioner said, for well over a year. And many of the suggested changes had either been implemented or were in process. And since October 2024, we had been working frequently in partnership with CMS staff to harden our processes, minimize risk, and prevent fraud. As we were implementing CMS's suggestions over the past year and beyond, CMS staff didn't indicate that our work was insufficient. In fact, CMS had been a longtime partner, reviewing and approving multiple times how we administer Medicaid through our state plan and waivers. So we were disappointed to find that our draft corrective action plan was summarily rejected in an unprecedented way, with little substantive analysis of the facts and no time for the state and federal agencies to discuss and agree upon a corrective action plan that would be implemented. There are numerous politically charged claims of how much Minnesota has lost to Medicaid fraud. To be very clear, even $1 of fraud is too much, and our work to prevent and fight fraud is nowhere near done. Further, our investigations here in Minnesota are continuing and our findings evolving. But guessing about amounts is not going to solve the problem. We're particularly concerned that CMS did not conduct a recent audit to support this decision. It relied on off-topic and out-of-date reports from 2017 to 2021. Those reports are not relevant to the issues currently facing our state and our Medicaid benefits. Additionally, there are no facts to support withholding all funds from 14 programs. Even if there is a finding of non-compliance, the withholding must be based on specific findings. You can't just choose a number when you're talking about funding that is essential to so many people's health and well-being and could even determine whether people live or die. Right now, we're waiting for CMS to set a hearing date so we can address these issues. We're confident in our plan to address fraud in Minnesota, and we want to continue to work with CMS in service of the people of Minnesota. Thanks, Jen. Back to you.
Thanks, John, for those remarks and that information. So we are able to take some questions now. In order to ask a question, you can raise your hand using the icon at the top of the screen, and we'll call on you in order. So we'll start with Alyssa Chen at the Minnesota Reformer. Alyssa, feel free to come off mute and ask your question.
Hi, thanks for holding this briefing. I've heard some criticisms from providers who have said that the rollout of the prepayment review process has caused a decent amount of confusion and also payroll issues. So I know that right now, or initially, DHS is going to pay claims in the 13 Medicaid programs at the end of January and corrected that to today or tomorrow. And so I'm wondering why that decision was made, and then also wondering about the process that led to, I guess, the confusion in the first place. For example, why DHS did not include provider trade organizations in the design of prepayment review, which I think most people before December were under the impression would involve claims being processed immediately or close to immediately if they weren't fraudulent, or if they weren't flagged. Sorry, that was a two-part question. One is why was the timeline moved earlier? And then secondly was about the provider involvement in the decision.
Sure, maybe I'll take a first pass at that one. I think with respect to the timeline, and then we'll talk about provider engagement after that. I think the first thing to note here is that there was a pause in payment for all claims for the 14 high-risk services, including housing stabilization, because providers can still submit claims for up to a year after the ending of that benefit. So we paused all claims for basically the first warrant cycle, and we talked about this a bit in our last press availability about this issue. So that 2-week cycle of claims that are submitted, we paused payments starting December 23rd. So with claims submitted in that 2-week cycle up until that date, so that we could begin implementing with Optum the prepayment review process. There needed to be some time to provide that information, those claims, to Optum to begin the analysis, and also to make some technical fixes or updates to our system so that we could pay according to the results of the prepayment analysis. So that work has concluded. So the system has been updated in addition to Optum doing its first analysis of that 2-week cycle of claims. And as a result of that, we actually were ahead of the 30-day timeline that we have to pay claims. And we were able to release claims for that warrant cycle ending on the 23rd of December today, essentially. So we initially said, or previously had said, that the 27th was the date on which we would be able to release those claims, but we were able to, again, get the work done fast enough that we were able to release claims from that first warrant cycle 2 weeks ahead of schedule. That said, there was one warrant cycle of a delay, a 2-week delay, in essence, in terms of what providers are used to. Often we pay claims very quickly within 3 to 5 days after the close of a warrant cycle. In this case, there was a 2-week lag to implement the new process, and then providers will now get paid on their usual biweekly rhythm, but for basically a warrant cycle previous to the one that just concluded. So basically 2 weeks behind. It's sort of like when you start a new job, you may not get a paycheck after that first 2-week period, but after the second 2-week period for the first 2-week period. So it's basically a 2 weeks behind the conclusion of that period. They're getting their payment for those services. So that's kind of the timing piece of why we were able to submit claims faster than anticipated. And again, for clean or unflagged claims, our requirement is to release payment within 30 days. So that was the initial January 27th timeline that we provided. With respect to provider communication, we were certainly implementing this process as quickly as we could, given the scope and depth of what we were dealing with in terms of program integrity concerns. So we were pushing hard to, again, implement a new solution to enhance our systems and our work such that we were proactively preventing fraud and enhancing program integrity. So in service of that, we did have a more compressed timeline for implementing the solution than perhaps past work or other types of implementation because of the urgency of the situation. And we certainly acknowledge a lot of feedback that we've received from providers and associations, and we'll want to continue to improve our partnership with them, our communication, feedback loops, and certainly understand the feedback that providers have given to us, and want to make sure that we're as clear as we can be in terms of setting expectations about what's coming and hearing feedback about the hardships that providers are experiencing. And we will certainly do our best to respond to those while also ensuring strong program integrity with this new prepayment review process.
Thank you.
Great, thanks, John. And up next is Matt Blake at MinnPost. Matt.
Hey, thank you guys for holding this. So I wanted to make sure that I understand what DHS understands CMS to be communicating with you. So is your understanding that the January 6th letter from Dr. Oz is completely suspending all payments, all federal payments in these 13 programs, and so that you are losing, if it were to happen over the course of the year, this $3.75 billion? Is that your understanding? And then the second part of the question would be, if it is your understanding, does the appeal of this then put a pause on that federal action, or would you have to take an additional action like civil litigation in order to override the CMS decision?
Thank you for the question. So what we believe Administrator Oz communicated to us was that there is the possibility that CMS will either defer or disallow in a withholding. So they haven't identified which of those options they're going to use. So a deferral is holding the funds until some action is taken from the state to the satisfaction of CMS to release those funds or those payments, or a disallowance, which means they will just not pay a certain amount. So there's a withholding, either in the form of ultimately deferrals or disallowances up to roughly $2 billion a year or $515 million quarterly. That is what they communicated, or, and they wrote in the letter, some other specified amount based on findings. So they have indicated also that they will begin a more sustained review of our claims for these services, which may inform some other amount, depending again on findings. So we're not exactly sure yet, but basically what they communicated is that their intention at this point is to withhold $515 million quarterly, either in deferrals ultimately or disallowances, with the potential to identify a different amount based on findings that may arise through our work with them in the coming weeks and months. So there's some uncertainty here, but those are the different possibilities that they raised in their communication.
And the 3.75 billion, then, does that also include state funding? Is that why Oz put that number in his letter?
So the 2 billion would be withholding in federal funding. That's our understanding of what was written there. It's 515 million in federal withholding. So that's our understanding based on what he communicated.
Okay, thanks for that question, Matt. Let's go to Kirsten at KSTP. Kirsten Swanson, go ahead.
Hey, everyone. Thank you so much. Just a follow-up quick to what Matt was talking about there. That $515 million quarterly is the federal government's share of Medicaid. Is that your understanding?
No. So basically, they said that they were calculating an amount equivalent to 1/4 of the full cost of the 14 services. So we actually think that is a higher amount than the actual quarterly amount that we calculated ourselves. But that is what they are basing the amount on. We're not sure where that figure comes from. They basically just identified 1/4 of the billing for a quarterly kind of spend for those 13 or 14 services rather, and that's what they indicated they were basing that $515 million amount on. So 25% of 1/4 of spending for those 14 services. Again, that is not based on any findings or audits that we're aware of.
Okay. The question I do have is kind of following up a little bit on what Alyssa said. How is what the feds are threatening to do here to defer payment different than what you all are doing with the prepayment reviews? Because to her point, individuals are not getting paid during that period while you're reviewing those claims. So how's what the feds are doing different than what you all have already instituted with the prepayment reviews?
I think that's a good question. So these are actually quite different processes. So we are basically looking at all claims for providers who are delivering the 14 services and ensuring through analysis with an external vendor that they do not have concerning kind of patterns or issues with respect to program integrity or fraud. And within a 2-week period, we have implemented this new process, and we are able to, after a 2-week pause on paying all of the claims, to release payment for that December 23rd warrant cycle. And providers will continue to get paid on a biweekly cycle going forward, basically 2 weeks behind the usual schedule. And what we will do is withhold individual payments associated with concerning claims while we're either following up to verify that the claims are appropriate, or if there is an enduring program integrity concern, referring those for investigation with our Office of Inspector General. So that is a different kind of real-time processing of claims, vetting them for any concerns, and then releasing payment within a 30-day cycle. What CMS is saying here is they're going to basically withhold possibly up to $2 billion annually until we make some action or set of actions to address program integrity concerns. And in the letter that CMS sent to us, they did not indicate what those actions necessarily would be. So they requested two specific things in the December 5th letter. We included those and other actions like prepayment review, enhanced prepayment review, in our corrective action plan on December 31st. There was a reply from Dr. Oz on January 6th saying that was insufficient, but without indicating what else we needed to do to make satisfactory progress or to improve our program integrity infrastructure and activity here in Minnesota. So there isn't really, there isn't a set of outcomes here or actions that's been clearly identified to support the withholding that was indicated in the January 6th letter. So I think we will look forward to, again, the appeal process, understanding typically when CMS issues or asks a state for a corrective action plan, it's based on an audit and discrete or specific audit findings. And a withholding usually comes associated with specific findings if a state does not make adequate progress at implementing a corrective action plan. So we have moved as swiftly as we could, given the communications that we have received and the direction we've received from CMS, and we will continue to do that, both according to our own plans and our response to the program integrity concerns that we have, but also in partnership and in conversation with CMS, and we hope they will partner with us on that initiative.
Thanks, John. Let's go to Jesse Van Berkel at the Star Tribune. Jesse, go ahead.
Hi, folks. A couple questions for you. First, Dr. Oz's letter did say that some of the missing pieces were enforceable timelines to implement changes and metrics to evaluate the effectiveness. Are those pieces that were missing from your plan in December, and are you adding those?
So there were timelines indicated in the corrective action plan that we indicated. And certainly, I think we are open to feedback from CMS and conversation about areas where we can add detail, where we can add different milestones to the plan and texture and detail. But again, we had 26 days to develop a plan based on the letter that we received on December 26th, gave that a strong effort in those 26 days, submitted it on time, and are certainly open to conversation and feedback from CMS about that plan. What was unexpected was the unprecedented nature of the January 6th reply from Dr. Oz, from Administrator Oz, in that there was an immediate kind of rejection of the plan and a very large withholding associated with that, without direction in terms of the specific things that were expected or revisions requested to the plan. And so I think that is what we are communicating here in terms of our appeal and what we are disagreeing with.
Got it. The second part of my question, Commissioner, you had said this could have catastrophic impacts on Minnesota. And tell us a little bit about the contingency planning and specifically what this would mean for folks if you do indeed lose this funding.
Yeah, thank you for that question. I think that's something that we are working very closely across state government. We're going to need to work with MMB and our legislature. $2 billion is very significant and will affect the state budget. It'll affect DHS, and it's hard to overstate the impact it will have to Minnesota. I think how we manage should this come to pass is something that we will have to work, like I said, carefully with others. I am hopeful that CMS will work with us constructively. We have been working, like I said, accelerated our efforts, and we have taken a lot of steps over this past year to strengthen program integrity. And I think CMS should be able to see that in our work. We're happy to show all of our work. And as John said, we are more than willing to lean in and do more if they have specific examples or direction of what they would like to see. We will make that happen.
Thank you, Commissioner. I want to let people know we are going to run out of time before we hit all the questions. So if we don't get to you, please email me your question and I will do my best to get you an answer on your deadline.